All right, so this is the surgical setup. That's our staff member, Jeremy. She is missing a central incisor, and we are going to place the implant today. That's our surgical gown, our isolation gown, I should say. I'll have to mention that this is before the COVID-19 restrictions. We did this procedure in February, and so you'll see some deviations from the current standards, but we are still using surgical gloves that are sterile, and the bouffant caps, the level 3 masks are all there, but you'll see my mask is not covering my nose there. So I'm just measuring the thickness of the gingiva right now, because I plan on just doing a flapless surgery. So I'm just going to start with the pilot drill. Of course, I've already reviewed her CT, and so I have an idea of where the bone is and how far I'm going to be drilling, and what size implant and how deep we'll be placing the implant. That's my assistant Dominique, and so yeah, we're just getting started here. She's already frozen. Jeremy obviously is frozen. She's got a couple of carps of articaine already in the area. So we're just going to move up the sequence of osteotomy drills. I'm using the Nobel active drill set, but I will be placing, and I'll be finishing with the hyoscine drill, and then placing a hyoscine implant. I believe the implant size, is 3.2 or 3.5 by 15. So we're gonna place a long one in there. So we're still kind of in the pilot hole stage here. The pilot hole is, in my opinion, the most important part of the surgery, like creating the pilot hole in terms of the direction and depth. It can be challenging after the pilot hole is completed to change the direction of the osteotomy, although it's still possible with liniment drills and whatnot, but it's just favorable just to kind of take your time getting the pilot hole and getting it in the right direction, rather than trying to correct it later. So I spend more time on the pilot hole than I do in every subsequent osteotomy drill. So that is that's just a surgical towel. It's been sterilized. We're just about done completing the osteotomy site. So I'm just placing a directional indicator to make sure that everything's looking good. And we're going to take a CT right after this. There's my other assistant Ashley. She's helping us take a CT. And so we can just see that the directional indicator is showing that we're in the right spot. So I'm just giving her a little bit more of a palatal injection here, because she's started to feel a bit of discomfort. So I like to just stay on top of it and top her up, rather than just keep going and then have her feel pain. So after the anesthetic, she didn't feel anything, and that is the implant. Okay, so it's a 15 millimeter, what looks to be a 3.2 or 3.5 hyoscine. So we're going really slowly. The hyoscine setup is different than what I'm accustomed to with the Nobel setup, where I typically hand torque the implant into the bone. Whereas here we're using the handpiece and we're just torquing it to 30 Newton centimeter. I still like to hand torque the last part of the implant to length, and so that's why I'll switch to the torque wrench and just kind of do it by hand. I find I just have better tactile sensitivity with the torque wrench compared to the handpiece, where it's automated, so you don't really feel too much. So yeah, I'm just confirming the thickness of the gingiva and the depth of the crestal part of the implant, so that we know we're at bone level, and that is a bone level implant. Okay, so we just put her flipper denture back in, and we're taking final CBCT. And that's where our implant is. You can see the placement is pretty good. It's right in the middle of the bone there. The length is good. We're in between the teeth, not really anywhere near the adjacent roots. And that's it.
So I hope you enjoyed that video. If you liked the video, or if you have any interest in general dentistry or implant dentistry, please like or share our video with your friends. And if you have any questions, please visit us at smilesdentalgroup.com. Remember, all of our implant consultations are free, so give us a call and we'll see you soon.